Good morning, ladies and gentlemen, boys and girls, and TRAXXfm fans of all ages. This is Anil on the mic, as always, back on air with you in the second hour of the show. And as usual, this is Health on TRAXX, where we bring some very formidable guests, experts in their various fields, to speak to us on matters concerning our health. And today we're going to talk about something that has been in our thoughts, our conversations. It's out in the media. It's been spoken about always, all the time. It's tangible and intangible, I guess. It's about cancer. We're talking about cancer awareness, HPV, human papillomavirus. And I once again welcome all of you to this discussion on cancer awareness. And today we are joined by a distinguished doctor, a professor, who will be shedding light on the importance of understanding and advocating about the awareness on this disease. And to help us with that, I have Professor Dr. Murallitharan Munisamy. He's the director at the National Cancer Society of Malaysia. Professor, good morning. Welcome to TRAXX.
Good morning. Thank you so much for having us on.
The pleasure's ours. And he's also flanked by Santhia Devi, who is the head of commercial at the National Cancer Society of Malaysia. Santhia, good morning.
Very good morning.
Welcome to Health on TRAXX.
Thank you.
So before we start off this conversation, maybe we can give our listeners just a very brief introduction about yourselves. Professor, maybe you can start.
Sure. So I'm a physician by training,
Right.
and I've been working with the National Cancer Society of Malaysia since 2018. So the society, a little bit about it, I suppose. So it's about 60 years old. It's society works all across Malaysia, different states. We do a whole lot of work, including community screening. We have halfway homes for people with cancer and their families to stay when they get treatment in hospitals. We do psychosocial support, which is sending counselors, psychologists into hospitals and into your homes when you need them. We do aid for drugs. Subsidized purchase of cancer drugs, and of course a whole lot of cancer education and awareness with the community.
Right. Great job. And Santhia, yourself?
Right, so I'm from the business development side. We've been working with NCSM for a couple of years now. I'm an awareness and community volunteer for NCSM. I work closely with the corporate sectors to transform how corporates look at contributing to the NGOs.
Right. Okay. So that's more from a CSR perspective.
right.
Okay. So yeah, Doctor, I think it's best to start this conversation with you. We always hear the word cancer. Both from a health perspective and also a psychological perspective. We sometimes even refer to toxic people as cancerous, but we're here to talk about the health concern.
Absolutely.
So tell us, what really is a cancer, doctor?
So actually, a cancer is pretty much an abnormal growth. Anyone at any point in time, any one of us, including you and me, this is the bad news, have some kind of rogue cells running in our body,
Right.
about 3 or 4. So usually, our immune system will kick in, kind of destroy these cells. Sometimes they miss it. Sometimes our immune system is a bit weak. Sometimes these cells run a little rogue. So it's just one cell growing wild in the body, and that's basically what cancer is.
So what causes this one cell to go rogue?
So a lot of reasons, and we're slowly starting to track these down. Some things are non-modifiable. For example, your genetic risk, or even certain types of cancers that you're predisposed to because you're of a certain gender, like males get prostate cancer, females
Right.
don't, that
Right.
kind of idea. But also we're seeing a lot of chemical or carcinogen exposure. So people being exposed to chemicals over a long period of time, and generally that kind of causes your body to have these mutations. This one cell waking up one day and deciding to go wild.
Right. You know, you mentioned carcinogen. That's something I often hear from my mother because, you know, when I eat satay, there are some parts in the satay meat that's a bit burnt. And she always reminds me, don't eat that, Anil. That's carcinogenic. You don't eat that.
That's absolutely right. Far be it from me from trashing one of my favorite foods and our Malaysian cultural iconic dish. But yes.
Right,
So
right.
the burnt bits, the really charred
Right,
bits of satay,
right.
not so good.
So doctor, let our listeners know if cancer can be cured. Is there definite treatment for this disease?
So I bring good news.
Thank you. Right.
So we've got actually about 100 known different cancers. And most of them are rare. You got about 10 different cancers that are very common. Among women, breast cancer is very common. We always hear about breast cancer.
Yes.
And another very common cancer is cervical cancer. It's the third most common cancer among women in Malaysia.
Wow.
Now, cervical cancer, interestingly, is not really caused by a carcinogen. It's actually caused by a virus, largely.
Right.
And we come back to what you were talking about earlier, which is the HPV, the human papilloma virus. So you basically get this viral infection, like you get COVID or you get the flu, influenza, all this dengue, all these different kind of infections. They harm different parts of the body. The HPV virus sits quietly, incubates, and starts to push your cells to transform. So they cause the mutation that becomes cervical cancer.
Okay. Is this hereditary, doctor? I mean,
No, so it's really an infection. So it's a viral infection
Okay.
that you can get, but most importantly now, you can vaccinate against. So that's the good news that I'm here to talk about this morning. HPV vaccination prevents entirely cervical cancer.
Okay.
So cervical cancer is about 97% caused by HPV. And by vaccinating against this, a girl is entirely, for their entire life, free of the risk of picking up cervical cancer.
Wow. Santhia, you have anything to add on that?
Well, I think precisely
Yeah.
as what Doctor has mentioned, cervical cancer affects women, and as a result, the whole family is affected. So children, they are also affected. So I see this as a very powerful women empowerment component. So statistically, it shows statistically 97%. If they are vaccinated, we can prevent this cancer. Yeah.
Okay.
So it's very important to bring this to the awareness of the public and to get screened. Thereafter, to get vaccinated.
Okay.
So you talked about a cure, sir.
Sure.
This is pretty much as close as we can get to
close
not
as we-
having you ever get this cancer in your lifetime.
So it's a medical breakthrough then.
And not it's been broken through for quite a while.
Oh, okay. Right.
But I
Right.
think
But now it's coming out of the limelight now.
Absolutely.
Yeah.
We were having a chat earlier. So
Sure.
there was another concern I raised. I asked doctor. So what if someone is already having a HPV virus, and how would this affect if they are vaccinated thereafter? Is there going to be any issues, or are we going to prevent thereafter?
Okay, right.
maybe-
Okay. You can hold that thought. We're going to jump in for a quick break. When we come back, we'll resume with the discussion. For those of you who just joined us, welcome to Health on Tracks. Today on the show, I'm speaking to Professor Dr. Murallitharan Munisamy, Director at the National Cancer Society of Malaysia, as well as Santhia Devi. She's the Head of Commercial at the National Cancer Society of Malaysia. And today we're talking about cancer awareness. Keep it right here. Health on Tracks. We'll be right back. It is Health on Tracks indeed. For those of you who've been with us right from the beginning of the discussion, welcome back. For those of you who just tuned in, welcome. This is Health on Tracks with me, Anil, on the mic, and today I'm speaking to two lovely people. One of them is Professor Dr. Murallitharan Munisamy, Director at the National Cancer Society of Malaysia, as well as Santhia Devi, the Head of Commercial at the National Cancer Society of Malaysia. And today we're talking about cancer awareness. Welcome back, Dr. Santhia, to the discussion. Now, Doctor, when does someone need to get tested for cancer?
So, and within the context of today's discussion, we're talking about cervical cancer. And so generally you're looking at about the ages 35 and above.
Okay.
So with a family history, we all often talk about people 40 and above as well. So with a lot more people having a family history, it's not so bad an idea to start even earlier in your 30s.
30s,
I think,
right.
yep. Getting a good baseline check of cervical cancer, for example, and there's usually two big ways to get around doing it. One is to get a pap smear. That's a bit old-fashioned.
Okay.
The doctor goes in and takes a sample, but nowadays we've moved more to doing HPV DNA, which is an interesting test where patients can actually do self-sampling. And they then send off, they take their own sample and they kind of send that off, and then that tells you whether you have HPV.
Okay.
So it's a really good test because you're going back a bit earlier.
Okay.
So with a pap smear, you see whether you have abnormal cells or not.
I see.
With HPV, you actually pick up whether you have a HPV infection, and from there you can already start treatment long before any chance of you kind of picking up cervical cancer itself.
Okay. Now, just to segue a little bit, Doctor, we're speaking about cervical cancer. Just thinking about men as well out there might have the same question about prostate cancer. How common it is, and how soon can they go get tested?
Okay, so but prostate cancer is a bit interesting. It's kind of a cancer for older men. So we're looking at your 50s. Nowadays, a little bit in your late 40s, people can start screening for it. But generally, most guidelines are talking about men above 50. So it's a cancer of the older men. For younger men in their teens, 20s, we're looking at testicular cancer.
Okay.
Same region, but not the same organ. So
I like the way you put it, Doctor. Yes.
so that hits men that's much younger,
Right.
and that is actually something that you can examine yourself
Okay.
after a shower every month.
Any lifestyle habits that contribute to that? This testicular cancer.
Again, it's a quite a rare cancer. So quite a bit pertaining to, I would say again, carcinogen exposure. The problem is we got a lot of carcinogen exposure all around. Yep.
Okay. All right. Thank you very much for entertaining my segue, Doctor.
Absolutely.
Now, back to our discussion. So now, this is the question that comes when someone is at the crossroads. Now, they've got themselves tested, and now they find out that they're suffering from cancer.
Absolutely.
What do they do?
So generally, a lot of people get worried because a lot of our screening tests actually show that you have an abnormality. It doesn't really show you have cancer, right? In order to confirm you have cancer, you have to get a diagnostic test.
Okay.
Basically something called a biopsy.
Biopsy.
However way they get around to taking it, they can use a needle, sometimes they use an ultrasound, sometimes they use a surgical procedure, and then they have to get to that tissue, take it out and look at it under a microscope. And
So it's literally just scraping a piece of your flesh out to perform a test.
Absolutely.
Not painful, right, Doctor?
Not painful at all. We
Okay.
do it under anesthesia nowadays.
Okay.
In most cases. Sometimes it's just done very simply, very quickly,
Okay.
in about 5 or 10 minutes.
Okay.
Our challenge is getting people to get to a biopsy. So that's the challenge. And after a biopsy, starting treatment. So a lot of people are scared, they're a little concerned. So some people, even with an abnormal test, will suffer in silence for years, just dying of the worry, thinking that they may have cancer. But that sometimes it's just not true.
Yes.
Because just with an abnormal test, it doesn't mean that you have a cancer.
Cancer.
And of course, when people do have an abnormal test and it does turn out to be cancer, the longer you delay treatment, the worse it becomes. Because in cancer, really, time is life.
Time is life.
Yep.
And see, now I'm thinking of something that I typically ask most of our guests on Health on Tracks. When you talk about matters concerning healthcare, of course, it's the best thing to do is to go and get opinions and advice from a trained medical professional, doctors in this case. But then there are alternative medicines out there, alternative medication out there, which oftentimes can be classified as a fallacy. Sometimes people believe that, this works and that works, and there's this research that says this, and people come up with some new coffee or a tea that's supposed to have some magical, compounds in it that can cure. What are some of the fallacies you want to debunk right now on the show, Doctor?
Okay. So when we're talking about this term alternative, right, I hate the word alternative.
Yes.
Generally, we tend to use the term complementary.
Complementary.
Going along with.
Okay.
So generally, if someone is going to propose a treatment to you that starts off saying, look, you're not supposed to take conventional treatment, it's something fishy. So usually most treatment now, like for example, there's excellent traditional medicine. Some of my colleagues in the government in Putrajaya, a few other centers, UCSI and all that, for example, they do a lot of traditional medicine which complements cancer treatment. So it helps to treat the symptoms and all that. Then of course there's the unknown fake news chaps of the world who will be selling products. Now, so the first fallacy that I was telling you, if people generally tend to tell you that, you cannot take anything except my treatment, that's quite dodgy.
Okay.
The first. And the second is, and which is the case with most of these things, they actually cost in the hundreds of thousands of ringgit.
Of course.
And if conventional treatment is expensive, complementary treatment is nowhere as expensive. It's small, minute doses of treatment or therapeutics. That is just to support kind of your conventional treatment. So it's cheap. The moment someone peddles something which is a couple of $100,000, 50,000, these abnormal sums relate to abnormal outcomes. Absolutely. And the third one, while we're on the topic, I think is on the fact that if you're going to take nutritional supplements, because a lot of them will propose to you things out of this world, moss that grows on the far side of the moon.
Far side of the moon, or something,
a
flower that has been taken from Mount Everest that only blooms once in 10 years or something.
Absolutely. So, good nutrition and supplementation, nutritional supplementation is available on the shelves.
Okay.
If not from every single plant, animal, vegetable that you see around you.
Okay.
So if there is again this push to, you need to take this abnormal product which only comes from the dark side of the moon twice a year, it's coming from Dodge Hill.
Okay. Santhia, I want to get your thoughts. Now, what is the level of understanding in terms of awareness that is out there among Malaysians when it comes to cancer?
Right. So this has been many years of effort, right, for us to bring to the public the awareness of cancer, screening, vaccination, and all this. So it's an ongoing effort. However, like what doctor has mentioned earlier, it's the mindset. Some will get like a mental block, right?
Yeah.
So what if it's positive? So awareness-wise, it is there here in this century right now. People know about cancer, the effects, all of this, but are they ready to get out, to get tested, and thereafter the treatment? So NGOs, we are doing our best to create this public awareness in various ways, So, but again, it's the individual. Yeah. So I think talks like this, it probably it will help.
And I think apart from getting medical help, psychological help as well,
Definitely.
because the way patients deal with receiving such news, it varies from person to person. Professor, your thoughts on that?
Yeah, absolutely. And rather than suffer in silence, or worse, listen to sometimes well-meaning, well-intentioned people with absolutely no idea what's going on, I urge you all, pick up the phone, call one of us. We have a toll-free line at 1-800-88-1000.
1-800-88-1000. Okay.
Yep. I can do that quickly now. 1-800-88-1000.
Okay.
We offer psychologists, counselors, even peer support personnel who are people who have gone through cancer themselves. Let them speak to you. It's entirely free, and you can do it face to face. You can do it virtually if you're somewhere else outside KL. Let them give you an honest opinion, a scientifically valid opinion, and that'll help you far away than listening to everybody else's
Absolutely.
chicken soup stories. Sometimes.
Absolutely. That's one thing I always, when I would talk about something concerning health, or, this one gives you health benefits or that, at the end of my talk set, I always put a caveat. I am no doctor. If you have your local physician, go visit him and get an opinion. Yeah.
right.
We'll jump in for another quick break. When we come back, I have to say, I'm having a great time having this conversation with you. And I'm sure our listeners are having a great time too. We'll jump in for a quick break, ladies and gentlemen. When we come back, Health on Tracks resumes. Keep it right here on TRAXXfm. Good morning, everybody, and welcome back to Health on Tracks with me, Anil, on the mic. Today, Anil is not alone. Anil is speaking to two very lovely people. First, I have on my left Professor Dr. Murallitharan Munisamy. He's the director at the National Cancer Society of Malaysia. Professor, welcome back.
Thank you,
On my right, I have Santhia Devi. She's the head of commercial at the National Cancer Society of Malaysia. Santhia, welcome back to
Thank you.
Health on Tracks. Now, one very important thing that I want our listeners to know, that on this discussion, we really aim to empower and we want to inform our listeners, because we want to foster this awareness on this very pervasive disease called cancer, right? And I believe that the both of you are here also to share some insights on an upcoming project, or rather ongoing project. Prof, maybe you can start off.
Absolutely. So I'm coming back to what we spoke about this morning, the chance to actually give a good end outcome to people who may never be, so that they are never at risk for cancer. So working with the Japanese government, a big manufacturer, some other corporates, we managed to get a donation of 300,000 doses of HPV vaccine.
Wow.
Into Malaysia. And what we're doing we're running this program called Leaving No One Behind. We're working through every state, every district, every small community to vaccinate underprivileged households, single mothers, kids who have chronically been ill and not at school, people from Orang Asli and Orang Asal backgrounds. So we have teams all throughout the country going out and getting this done. Right. So my first kind of call to action and ask for assistance from our listeners is, hey guys, if you have a small community, would like to participate onto this project, you know, people that you work with, groups that you support, underprivileged communities, get on to us. Just drop us a note. There's a website running at hpv.cancer.org.my. That's hpv.cancer.org.my. You can see the progress of the campaign as well.
Wow.
And what we're doing. Like, for example, just last week, we were all throughout Perak vaccinating in homes of special needs children. These are children who've never been to school.
Wow.
But they have a risk of getting cervical cancer as well.
Right.
So vaccinating them to make sure that they don't have this additional kind of burden to deal with. So that's how micro we're going onto the ground.
Great.
All across Malaysia.
Santhia, any thoughts?
Well, I think to support this program, this was launched at Parliament last year in November, yeah?
Okay.
So to support, we NCSM, we have many initiatives going on, like programs. So NCSM is a 100% not-for-profit organization
Okay.
with no government funding, yeah? So raising fund, this has been the most challenging, right? So no doubt we receive good support from the corporates, but the true need for cancer treatments and the big aim NCSM have, which is to leave no one behind,
Yeah.
we definitely need a lot more than what we are receiving now. So it was on a traditional approach in the past years, but now with the ESG sustainability in health component, it caught the attention of corporates. So doing good, is something that's happening right now. Yeah.
Correct. Corporates always, every year, they have something called a sustainability report because they want to
That's
show
right.
investors how much they care about society and community. And I think I like what you mentioned, Doctor, is that there are people out there who may have access to the communities that you and I don't have access to, who don't have access to the information that we have access to. And these are the people that we need to be reaching out to.
Absolutely.
Hence, leaving no one behind, leaving no stones unturned. Now, for the benefit of our listeners who are eager to contribute or to play their part in helping National Cancer Society Malaysia, Santhia, perhaps you can share how they can, maybe send a donation or things like that.
Right. So how public can be in touch with us, as Doctor mentioned, there's a toll-free hotline, which is 1-800-88-1000, or they can go to the website cancer.org.my. For corporates, they can get in touch with me through email, which is Santhia, SANTHIA @cancer.org.my.
Okay.
Right. But they can tap on to all those initiatives that we are doing. NCSM is having throughout this year. HPV is the main target. So one of it is a golf tournament. So this is for the corporates. It's called GSM Cup Golf Tournament, which is happening this coming Friday on the 8th at Kota Permai Golf and Country Club. So we have good, support from the corporates like Western Digital, Mercy-Like, RHP Insurance, as well as Volkswagen.
Okay.
So we urge, the support from more corporate organizations to help NCSM to actualize our vision.
Yeah. Okay. Thank you very much for sharing your thoughts. And also thank you very much, Doctor and Santhia, for being with us today on Health on Tracks. Time is of the essence.
Absolutely.
We have
Time is life.
Yeah.
Time is, as what you mentioned. Yes, time is life. But before I let you go, I'm going to start off with you, Doctor. Any final words that you'll have for our listeners before I let you off for today's Health on Tracks?
Lovely. Thank you so much for having us once again. My only message is, as I was saying, most cancers we can't do anything about. We just have to wait and then treat them. Cervical is something we can do something about. We can stop our girls from ever having to get it in our lifetime. So please help come onto the program, get people onto the program, bring out communities to get vaccinated. Give us a call. We'll come on site, even on an island, through the floods in Sabah and Sarawak, anywhere. We need to get to you. Help us get to every single Malaysian girl who needs to get this vaccine. And most importantly, support the program so we can help everyone together.
Ain't no mountain high enough, ain't no valley low enough for the National Cancer Society of Malaysia, Doctor. Yeah,
absolutely.
Santhia, your thoughts?
Yeah, thank you so much for having us. And I think Doctor has said it all. So do remember, there's a toll-free line that you can reach out to us. And at any point of time, drop us an email, or you can reach out for more information in the website.
Okay.
Thank you.
Right. Thank you very much, Dr. Murallitharan and also Santhia. Today on Health on Tracks, I just wrapped up a very interesting conversation with our two guests. First is Professor Dr. Murallitharan Munisamy, the Director the National Cancer Society of Malaysia, as well as Santhia Devi, the head of commercial at the National Cancer Society of Malaysia. And we spoke about cancer awareness and also how you as the public or we can contribute towards developing and also enhancing the great work that they're doing right there. If you missed out on any part of this conversation, worry not, you can always catch the replay on our official Facebook page at TRAXXfm, or you can also tune in to our official YouTube channel at TRAXXfm Official. Time on the clock right now is 50 minutes past 11 in the morning. In 10 minutes, we'll be crossing over to the RTM Radio News Centre for the 12 o'clock news bulletin. And then right after that, yours truly, Anil on the mic, will be back for the third hour of TRAXX Momentum. And I tell you, the music does sound better with the two of you.